All right, let's get started here. Should be popping up. There we are. All right, actually, we're getting advanced here. Here we go. So here's the beginning. So today I want to present with you on a kind of researched, evidence-based periodization for a 16-year-old female volleyball player who's looking to improve in performance as far as like agility, vertical jumping, but also has some chronic knee pain going on one side, and we need to consider that and also try to help that improve and resolve. So let's get into it. We're first going to cover some objectives here on just a brief overview. We're going to cover why the athlete will need a individualized, periodized, and more of a diverse training program compared to just one or two things, just improve flexibility, just improve strength, things like that. We're going to notate a few key research articles and what their findings suggest, and then we'll apply some of those, get into more of the nuts and bolts on sets, reps, progression, things like that. So a big why, because the why is going to help us determine what we do. So unfortunately, a lot of knee injuries and just knee pain is part of volleyball in the female demographic, and there's a lot of reasons. We'll go in the next slide on why that may be, especially if they're around growth spurts or this peak height velocity. They're definitely at a higher risk for developing knee pain. Secondly, early sports specialization is also regarded as a major risk factor as well. So break down the predisposing factors on why we think this type of athlete would be presenting with knee pain in this sport at this age. First of all, we understand that the skeletal system grows disproportionately to the muscle myotendinous units, and those actually alter this number 4 here, usually cause an altered sense of proprioception, kind of like if you looked into a mirror that was normal, you would have a good reflection, but during these growth phases and several years after that, it's like you're looking into like a carnival mirror where it's really distorted, and there's a lack of proprioception, which affects not only biomechanics, but actually affects the body's ability to generate force and neuromuscular coordination, as far as strength, power, things like that. The female also will eventually develop a wider Q angle. In high school volleyball athletes, it's been estimated they may accumulate over 10,000 jump contacts in a week, which is quite insane, especially if you couple that with, this growth spurt, lack of proprioception, their diet might be subpar, who knows what, it is a pretty good recipe to develop knee pain. And then lastly, core stability, the motor control of the trunk has also been extrapolated and suggested as a element in this as well. All this leads to overload, excessive strain around the knee, leading to energy leaks, which can decrease performance, and excess passive structure stress. And that article that I was referencing has a nice little diagram here of, so if these are all the factors kind of contributing to lack of performance and knee pain, then what are things you do to help with that? So that's everything from appropriately dosing and implementing type of plyometric training, core stability, proprioception and balance, movement pattern correction, and eccentric loadings. And their examples like the Nordic hamstring exercise, so like learning how to handle high forces eccentrically is key to not only increasing vertical jump and increasing dynamic stability, but also injury prevention. So both major goals for this athlete. Hence, we have like a little trifecta here of what we're going to focus on over the next roughly 4 months of elements to train. So we're going to progress strength, agility and plyometrics, and also neuromuscular coordination or exercise, kind of these base patterns. But before we can figure out, what we're going to do, we need to kind of determine, how we're going to determine if we're actually accomplishing our goals, month to month. So we need to develop some assessments that are going to serve us as waypoints for progress. We want to do these about every 4 weeks. So that would be a pre-test, and then you have a week 4, 8, 12, and a post-test. And this will help us tweak, customize diet and training things. As far as resistance training, I mean, this is not a powerlifting athlete. Our goal is not to improve our 1 rep back squat. Hence, we're not going to measure that. Plus, she is a beginner. She is not going to be skilled in just simply moving herself in weights. So we're just going to calculate how her strength is progressing indirectly using weights that may be around her 5 to 10 rep max, and then using calculations to determine that. There's a few core lists we definitely would want to see those in that I've listed here, like the back squat, a split squat, got 30-degree bench press. Just some core movements that have been shown in research to be tested in volleyball athletes using these compound lifts to improve their agility and vertical jump. Vertical jump is simply, we're going to use counter movement jump and the Balakov jump, which is simply using both arms while you jump off both legs. They're different, and using the actual arm swing is pretty sport specific, so we want to include that as well. Agility, there's 4 tests here that has some really good metrics in the research as far as their applicability to the sport. The knee pain, we can track that using this particular questionnaire that is recommended in the latest best practice guidelines for managing patellofemoral pain. And body composition, we're going to defer using the kind of standard the 7 or 8 point skinfold test with the calipers, just because unless you or I are highly trained in it, our accuracy is just not going to be great, and test retest is not going to be that great. Some research that says it could be as high as 50% off as far as calculating the body fat percent. So she may really be 30%, and I may be calculating at 18% or less. So we're going to use the handheld bioelectric impedance devices, which are actually shown to be pretty reliable and accurate as far as getting within 2 to 3% of these really expensive standalone units. So we're going to do a brief flyby of kind of just what her blocks of training would look like. So if it's 16 weeks and I broke it up into 4 blocks roughly, what it would look like. So being that she is a beginner, low experience to any sort of formal resistance training, we're actually going to do high frequency but low volume per session, just to basically get practice reps at all these movements. And we're going to, kind of be hopefully going from a state of having knee pain to actually getting out of that. And so we're going to have to gradually expose her body to load to get and allow time for that to kind of remodel before we actually progress intensity in the weight room. So basically, first week, we're going to do neuromuscular training as a warm-up, and the research says that couples well as a warm-up for either weight training, plyometrics, or volleyball practice. So it's usually about 15 minutes, and there's a way we'll get into about how she can progress that warm-up, and then the full body resistance training will just be 2 to 3 exercises per body part. So we're going to do a lower body, you're going to do a push and a pull, and we're going to do 2 to 3 exercises per body part, and to start out with. And then weeks 5 through 8, we're actually going to split lower and upper, and then we're going to have a full body resistance. So still on this, we're actually going to 2 days a week, which will be like the rest of the program. We're just going to train each body part twice a week, because we're going to be progressing the intensity a little bit more in each training session, so don't need the frequency as much. Week 9, we're going to allow it to be a deload week, just to let any accumulated stress in the first 2 months kind of dissipate a little bit, and also prepare us for the blocks 3 and 4, which will be more intense as far as higher intensities in the weight room, and actually doing true plyometrics by this point. And that's why we're going to only train twice per week, and we're actually going to split it up as a upper body, lower body, upper body, lower body, just again to kind of space out the stress throughout the week. So we're doing a little bit more intense each time. We're just going to allow a little more breaks between. So let's actually start getting in the nuts and bolts just a little bit. So the neuromuscular training, which is going to be part of the first 8 weeks of training. Think of it as almost like a glorified warm-up. But the research behind this is pretty good. Again, it's like, why? Because if the athlete or this athlete doesn't have the best motor control, movement patterns, kind of secondary to these growth-related proprioceptive insults, then this is going to kind of be the foundation to kind of get set the stage basically for her body to coordinate patterns well. Then we can add intensity and load to that. So these are, and this training itself has actually progressed, the warm up. So we'd start on the lower end here. A lot of these, this is kind of like a middle scheme here, but just 2 sets of some of these exercises. Start on the low side of the rep scheme. So if we're doing just some deep squats and body weight squats, we're just going to do 2 sets of 10 reps that first week. Second week, we may do 2 sets of 12 reps. And it should only take 15-20 minutes to do this. We're going to progress it though by volume. So that's each week we're going to add another exercise, and then we'll add a few more reps. We can also increase the density a little bit once they get more comfortable with the exercises, and reduce like the rest periods between the actual exercises. The research is pretty cool. They just had a control group that just did their regular volleyball practice. The other group used this as part of their warm-up. And again, this was adolescent females specifically. And look at this. I mean, their t-test improved 3% versus basically 1% on the control group. Vertical jump went up 12% versus 6% on the control. And again, I think a lot of this just goes to show you that if you can improve the coordination and the proprioceptive dynamic stability, then the body's going to produce force better, feel safer. And that's probably, I love this here because this is basically a motor analysis of the knee control on lateral jumping. Look at that, 22% better control versus 4% on the control. So I think this is just undeniably a good part of the early stage of training, which will later be replaced actually by plyometrics specifically. So these two right here are actually the same thing, just kind of one's more picture friendly than not. So I kind of use this as just a flyby. Like weeks 1 through 4, we're just going to start out in the strength training, just 2 sets of an exercise, and that's it. So say if we're doing lower body that first day, we're going to do 2 sets of a squat, 2 sets of lunges, 2 sets of a hinge, or hip hamstring dominant. That's it. And then week 2, we'll go to 3 sets. So maybe 3 sets of squats, 3 sets of lunges, 3 sets of a hinge. And week 3, we're going to get up to 4 sets, and stay at that 4 sets. Be the top end of the volume range per se. We're going to progress intensity based on how well they are basically improving. So we're going to use a 2-for-2 rule. So meaning if for 2 workouts in a row, they're able to hit the last, reps in that set, then you can progress the load, 5-10%, or just, a small increment that would keep you in that same rep range for that block. And then weeks 5 through 8, we're going to do basically the same thing as the first block, except we're going to start over on the sets. So start back over around 2 sets per exercise, build up some volume, but our intensity has gone up a little bit, using more of an 8 to 10 RM loads versus a 12 to 15 rep range. Nines are deload, and weeks 10 through 16 is kind of more of our strength focus block. So we're going to be using basically sets of around 6 reps. We're going to increase the intensity in kind of a 2-week chunk here. I think, yeah, so it's like, so in weeks 10 through 16, we're actually going to have a little higher volume of our sets, but again, we're only doing 6 reps, and we're not going to be training near to fatigue because we're only going to be around 75%. But then after the first few weeks, we're going to go down to 4 sets of exercise, but we're going to go up to 80% roughly on our loads. And then the last 2 weeks, we're going to go down just to 3 sets per exercise and increase up to 85%. And I would suggest using, especially for this athlete who is, again, still at this point will still be a novice trainer, to use like a rest pause or a cluster set method, which is what these charts are demonstrating here in the research, specifically with female volleyball athletes. I think it's great because it allows higher volumes of clean reps, good power, to mitigate injury and also improve performance. And I think that's why, I'll go back to this here. We can see the table a bit better. They compared basically a group during doing 7 weeks of strength training, doing straight sets of 6 reps, or doing cluster reps of 6 reps, or 2 by 2 by 2 clusters. And the cluster group here, look on this agility time. I mean, the cluster group saw 11% improvement in their agility versus only 2% in the straight sets. Vertical jump, cluster group, 6% improvement in versus traditional group, only about 2%. So you're looking at, basically 3 times the gains in their vertical jump, and 4 times the gains in their agility as far as the t-test time. So I think it's pretty worthwhile to experiment with some cluster sets there, and the true strength block there in the last half of their strength training phase. Progression of plyometrics. This is going to replace kind of that neuromuscular training warm up as far as their volume of training in the last half of this cycle here, weeks 10 through 16. We're going to start out low here. This is another study that was done well in female high school volleyball athletes. So the first week, we're going to do limited exercises, lower volume of total jump contacts. We'll be doing this twice a week as well. But then as they progress, we're going to progress the reps of the actual exercise and the intensity of the exercise as well. So by the time they're in the last few weeks, they're going to be doing double the volume of contacts plus at higher intensities, which is eventually what they're going to need to improve their performance. And this was just the results of this actual specific plyometric training in female high school volleyball athletes, was that their jump height increased 9% versus 5% in their control group, and peak power improved 8% versus only 4% in the control group. Lastly, we'll finish up with some nutritional recommendations. Overall, the athlete's not looking to do anything crazy, but we are looking to drop their body fat percentage a few points and drop their weight just a little bit, which should indirectly improve their performance, since they have less mass to move, but also can help with that knee pain as well, just with a little bit of loss of excess body weight. So general recommendations on what you would need from a nutritional background is this range here, this kind of 3,000 to 3,600. That's just a suggested starting, or the daily needs to be isocaloric at her age, her weight, and her projected training loads. So we could just start in the middle there around 3,300 and see how she's doing on that first check-in, and that way we could adjust as needed. Definitely would want to err on the side of getting plenty of calories in versus erring on getting too few calories and risking whether it's low energy availability or just subpar training results. And as far as macronutrient breakdowns, carbohydrates would fall within these range, protein in this range, and fat in this range per day, which should land you somewhere in around this 3,300 calories per day. All right, hopefully you found this helpful and informative.